Welcome, and thank you everyone for joining us for this concise and informative discussion by Dr. Michael Wald. Dr. Wald, you have many degrees and certifications in the area of nutrition and health, including 2 board certifications in nutrition. You are a doctor of chiropractic with a master's degree in nutrition, and you are a certified nutritional specialist. You have published successful books on natural health, and right now we will be discussing Lyme disease and chronic Lyme and antibiotic resistance. So Dr. Wald, many people seek you out with concerns regarding chronic Lyme disease. What are your thoughts?
Yeah, so Lyme disease has been a bit de-emphasized now because the world is dealing with COVID. But those other conditions, including Lyme disease and other types of infections, they haven't gone away. They're just not paid attention to. So there are a number of people that may have these infections and they're not paying attention to them, or they might be misdiagnosed. But what I can say to you is that from what I have seen over the last few decades, Lyme disease, particularly in Connecticut and Westchester County, but also in various areas all over the world, they're prime hotspots for Lyme disease. So Lyme disease is a tick-borne transmitted disease. And usually when a tick transmits Lyme disease, we have to remember that there's usually other infections that may be transmitted as well as Lyme disease on that deer tick. So there could be viral infections on that deer tick, viral organisms I should say, and also bacterial organisms, even parasitic ones. And some of them are extremely life-threatening and others are not as threatening. But Lyme disease can affect a person's life permanently forever if they let it. So one way to increase the risks of Lyme disease being a real problem is by ignoring it. So I never suggest ever that someone should not take their antibiotics. So doxycycline is usually the antibiotic used, and if there's an intolerance to that, or you're under 8 years old, they might use amoxicillin. And if there's issues with those medications in your past, they may have to try other antibiotics. And again, it's important to check for Lyme disease, but also to check for some of those other associated diseases, because you're going to treat Lyme disease and then there's this comorbid infection, and then you're wondering why things aren't working, and the doctor misdiagnoses you with chronic Lyme. Now, as far as chronic Lyme, so what does that even mean? So first of all, we have an acute Lyme disease infection, let's say, and there's 2 basic tests, the ELISA and the Western blot test. And the immunoglobulins are checked in some of these tests where there's immunoglobulin G and there's immunoglobulin M. And if a person has 5 or more immunoglobulin G molecules there, then that is said to be a positive test for Lyme disease and a person needs antibiotic treatment for that. Or their immunoglobulin Gs might be normal, or they may have fewer than 5, but the immunoglobulin M, the 3 immunoglobulins M that are checked, a person needs to have 2 of the 3, and that's considered positive also. So you can have positive diagnoses made based on the number of immunoglobulin Gs and or immunoglobulin Ms. The immunoglobulin M responds early in the course of the disease, immunoglobulin Gs come later, okay? So, and again, there's quite a bit to describe in terms of the co-infections, but they have their own associated tests. Now, a person might successfully get rid of Lyme disease with antibiotic treatment, and they still may not be the same as they were. They may have brain fog, they may have fibromyalgia-like symptoms, all kinds of problems. We've seen this with people for years. And that might mean that the Lyme disease is still there. Sometimes that is what happens, and other times it's not. But the person is damaged from the infection and the infection is gone, and they think they still have the condition. And then they get further confused, Sonny, when they're prescribed more antibiotics and they actually feel better while they're on the antibiotics. Because antibiotics are not just antibacterial, which helps Lyme disease, but they're anti-inflammatory. So the antibiotic may be making you feel better by lowering the inflammation. And then other patients, they don't respond very well to oral antibiotics, so they give intravenous antibiotics. And again, that is something that you only want to do if you absolutely must do it, because as the question poses, antibiotics can cause antibiotic resistance. This is a worldwide problem, and it's certainly a problem in the United States. For years and years, doctors have just prescribed way too many antibiotics incorrectly and not really considered antibiotic resistance until recently, and still some don't think about it much either. So there are ways in which nutrition can help offset these problems. So in my experience, if a person has Lyme disease and they're on their antibiotics, there's certain nutritional supports you'd want to give them while they're on the antibiotic to mitigate the antibiotic issues. So one might be a probiotic. Now there are different kinds of probiotics, different combinations of things. We don't have time to talk about those here, But just in general, we want people taking strong probiotics, but not within 2 hours of taking the antibiotic.
Time is
Because
important.
the antibiotic it's critical, Sonny, because the antibiotic will kill off most of the probiotic. And you want the effects of the probiotic, so you take it at a different time. And also, if you've been on one or more antibiotic treatments, the most common mineral deficiency of antibiotic use is zinc, which we need for immunity. So it's important to substitute the proper form of zinc. There's zinc citrates, there's zinc orotates, there's different forms, so you pick the right one for the person given their situation. So how you deal with chronic Lyme, if we're assuming it's chronic Lyme disease, meaning the person is just not able to kick the infection, things can be done to improve how antibiotics work. And again, I'm just giving you a couple of things here. One of those things, which is not commonly known, is the use of digestive enzymes. If you take digestive enzymes with antibiotics, there are studies that show that the enzymes will help push the antibiotic deeper into tissues. If you're going to be on an antibiotic, you want it to work. So the various pancreatic enzymes, either plant-based enzymes or animal-based enzymes, can help that process. Usually I'll use the animal-based enzymes because they're stronger over a wider pH in the body, so they have a greater chance of being used by various individuals who may have pH issues. So we've covered the basic testing for Lyme disease. We know what the main treatments are in terms of antibiotics. I've talked about zinc and pancreatic enzymes or digestive enzymes that can help the antibiotics work. And then if the person is done with antibiotics and they're still not there, okay, great. The antibiotics did their job, but they really kicked your butt. Then we need to use the proper nutrition to build that person up. So we figure out what that nutrition is, Sonny, based upon looking at their lab work and figuring it out, and then giving them certain things and then checking their labs again to make sure that the right things are happening, meaning their immune systems are responding, their nutrient levels are increasing, the nutritional utilization increases. And these are the ways in which we deal with acute infections, chronic infections, or chronic conditions of Lyme disease or co-infections. And the last thing I'll mention is that some of these co-infections have their particular nutrition, certain herbs, for example, that may be more antiparasitic than others, and some are more antiviral, some are more antibacterial. And then again, if you're going to take antibiotics, that may cause secondary fungal infections like candida infections, so we want to use other probiotics that are antifungal like Saccharomyces boulardii. And so it's a complicated consideration, but I've certainly had a lot of experience supporting people nutritionally with this, and these are the common things that I've seen. So I hope that was helpful.
Okay, great. Thank you, Dr. Wald. That was great information.
Great, thank you.